Maureen Abbott from Mental Health Commission of Canada, Brittany, Howell from Government of Newfoundland and Labrador, Courtney, Simonic from ORCHA Health, Dr. Patricia, Lingley-Pottie from Strongest Families Institute, Breau from Mental Health Commission of Canada, and Dr. Geoff Soloway from MindWell U.
I'm Breau with the Mental Health Commission of Canada. And so I just want to spend a few moments to set the context about why, what we're talking about today. And I think Dr. Sendel and Maria set the context really well about the need to have standards. And so up until recently in Canada, apps that are high quality, safe and effective was largely left undefined. And so we went about a journey to work with collaborators and interest holders and identify a platform that could help us do that work in setting a framework in Canada that can help us identify that quality that we all need, that gold standard, I think that Maria mentioned. And so we developed a really strong collaboration that's ongoing with ORCHA, and we'll get to hear it from them shortly. And we launched a framework in 2023. And so since then, we've been able to assess apps. And through this assessment process, a quality improvement process, it enables them to identify areas where they could be strengthened and essentially meet specific criteria that are unique to the Canadian context around privacy, data sovereignty, cultural safety as well. And it's meant to improve, so it's not a pass-fail system, but we really work in partnership. And since then, we've assessed over 20 apps. And we've also been able to then partner with different jurisdictions to develop curated libraries. And so the use case that we're going to talk about today is a library that was developed with the government of Newfoundland and Labrador. And we'll also hear from app developers themselves about their experience. And so we'll get right into it because the time is short. And I'll sit down and I'll ask questions and we'll go back and forth. And time allowing, we would love to engage with you as the audience. Take the mic. Is there another one? Yeah. Okay, perfect. So my first question, I guess, would be to you, Brittany. And if you could share with us about kind of the burning platform, what specific access or quality challenges were communities facing that this work aimed to solve? Why did you go about this journey?
Thanks. And anyone who knows Newfoundland and Labrador knows that we're quite a unique province. We have a lot of unique challenges in terms of geography and people kind of spread across the province. There's a lot of rural communities and a lot of communities, everyone knows everyone as well. So e-mental health in general is something that we really value and try to take leadership in our province. But when talking about the rural and remote communities, of course, some people aren't able to have that access right away. Some people need to travel quite a while to get to appointments and everything else. So being able to access care online is very important for that and kind of one of the things that we aimed to address with this. Beyond that, there is still existing stigmas, especially in small communities, but even when I think of my own experience and going to seek care for mental health, one of the first things you're thinking might be, oh, I know a lot of people who work in this space. So having that ability to access it anonymously and online in the comfort of your own home is obviously very valuable as well. And beyond that, just having that flexible and kind of on-demand support, 24/7 access is amazing. And it kind of helps, I think, all areas of the healthcare system. So it's meant to support, not replace, as we talk about with e-mental health a lot. And if you're on a wait list, if you are between appointments, or even for some aftercare, just having that connection with apps that your clinician can recommend, or you can kind of search for yourself. All of these would be reasons, I guess, around the access. But the quality piece, obviously, we saw some presentations today that talked about there being over 20,000 apps in the space. And just knowing that a lot of these are unvetted, you don't know if they're safe, you don't know if they're relevant. So having a library that has been curated by Newfoundland and Labrador and informed by Newfoundland and Labrador people to meet the needs that they have seen as their kind of wants and needs. I think that would be one of the main quality pieces, just having something from us for us.
Makes sense. Okay. Thank you. And it's a great reminder too, I think, for context, like we're swimming in an ocean of apps. And so, and if I'm going to borrow a bit of an analogy from the Maritimes. I'm from the Maritimes. My dad was a lobster fisherman. And so if you're looking for a buoy out there to keep you safe, you want to make sure that it's a good buoy that you're going to hang on to. And so you want to make sure that the apps that you're using are safe. And I think it was Anil that, from eMHIC that we were talking with, is that there's a higher threshold as well when we have publicly curated and financed libraries. I think the threshold of liability, as Maria talked about, is really high. And so turning it over to ORCHA, the Organization for Review, and I always mix up health and care apps, but I'll leave it to you to explain. There's many frameworks out there and type of tools that we could use to assess apps. Could you share with us about what your evaluation framework does? How does it differ from other traditional regulation or academic research? And why is that distinction important for real world implementation?
Yeah, so I think current space, everybody knows that everything is moving so fast. Innovation will always outpace regulation. So how do we kind of bridge that gap between traditional regulation, academic research, and usability and actual actionability of the apps, through our work with the government of Newfoundland and MHCC. The whole purpose is, these apps, 20,000 plus that are out there, are always going to be available. And ORCHA's mission is to make sure that we reach all of these, as many apps as possible, to make sure that they're safe, because they're always going to be available to patients. But how do we clearly define those that are properly vetted, have been assessed? And that's what we aim to do. And you are utilizing the MHCC framework specifically in this situation with the government of Newfoundland to actually make that actionable to patients and users, providers, et cetera. So we take that traditional regulation and kind of bridge the gap. We're not here to replace it. We're here to complement it. So there's three different areas that we look at, which is, the first is data and privacy. So, being transparent with how the app is using users' data, potentially what third parties are available in that app as well, and just being really transparent in what the app is actually doing for that end user and what they're doing with that data, encryption, et cetera. So that's the first element. The second element is that academic research or that clinical research as well. It's very in-depth for most applications in digital health tools, which is great, but we're here to kind of make that those innovators also kind of bridge that gap between getting that proof of evidence and ensuring that it's up to date. So, traditional regulation is usually looking at one point in time. We need to make sure that we're always continuously monitoring that application, looking at new evidence that's coming out. There's a lot of tools out there that add clinical calculators potentially. Do you have the evidence to support that? So, excuse me, it's the evidence that kind of goes into that continuous monitoring as well, and also allows our governments, especially Newfoundland and Labrador, to ensure that they're able to scale that. Because we're looking at objective data, transparent objective data, which, as you know, is better to do when you're trying to do something at scale, especially in provinces and getting out to patient populations specific to that use case and that patient population that you're trying to reach. And the third is usability and accessibility. That's the big part of MHCC's framework, especially with the cultural sovereignty and Indigenous populations, ensuring that the application, whoever it's intended for, was actually tested and used by that population. Whether it's the patient, the provider, whoever we're looking at, ensuring that they have the evidence to support that use and it is actually usable by that. So I just want to end it with, we're here to bridge the gap between traditional and regulation and academic research, usability, and not replace it, but actually complement it.
Excellent. And I hear the theme, of engaging people with lived experience, which is so core. And I think that sets the framework apart from other frameworks that exist out there. Before I turn it to Dr. Pottie and Geoff, another question for you. What could you walk us through or give us a little insights about what does it actually look like? What does the process look like for folks that are walking through the assessment process?
Yeah, absolutely. So, we try to really take on sort of a consulting role for these digital health technologies who are interested in participating in the assessment to try to guide them. As mentioned, there's tools out there. How do we make them safer? How do we make them more available to the patients and end users that they are aimed to be used by? So it's really important for us to build that relationship from the start. So it kind of goes into a kickoff call where we walk you through the assessment, the evidence requirements that we're going to ask for to ensure that the digital health technologies really know what we're looking for. A lot of the information that we look at, especially from the usability, the data and privacy, that's all publicly available information, doesn't require additional resources. And then we really try to walk the technologies through the clinical evidence portion of it. So once we, have that information gathering, we gather the evidence that we need for those products for the eMHCC framework specifically. Our team we have an assessment team that's, again, very objective. So there's a review engine portion and there's a manual portion that they go through the clinical evidence, the usability part for the patient populations, as mentioned. And we go through that assessment. There is a minimum 70% or higher passing score for technologies. And once we do that initial assessment, there's an improvement call to ensure that everyone is on the same page as far as what requirements maybe need to be met. We give you guidance on what is required that maybe you're missing, lack of evidence, or privacy policies, et cetera, trying to improve all those elements that we look at in that assessment so that the developers are really know what they need to improve their product for their end users, but also for the assessment itself. So once that information and that improvement call is done, we then do a reassessment for the digital health tools in hopes that they then meet that minimum 70% or above. And then once that's done, they have the opportunity again to look at that information, that scoring, and the evidence that we found, and we then give them the opportunity to be available to MHCC, the provinces, and the libraries.
Excellent. A fairly rigorous process based on continuous improvement. And at the end, you get the MHCC badge. I'd love to hear about your experience from an app developer perspective. So maybe I'll start with you, Geoff, about what that experience looked like. What was it like for you to go through the evaluation process? And if you can deepen in thinking about how did it shape your approach to quality improvement for the tools that you provide?
Thank you. I'm going to just start by sharing a little context of where I came from. So I come from a content expertise about 20 years ago, developing programs in psychoeducation, mental health and mindfulness, and holistic well-being, and then launched MindWell U about 10 years ago. So I've been working in this space for that long, and great to see the continued growth of the field. And when we went through this process, running content, running a business, and then coming into this process, definitely had a little bit of hesitation at the beginning. But then as we got into it, I really saw the value in terms of the feedback we were getting and improving the product for the end users. So, even seeing elements that were, I guess it was all making the explicit more implicit in some ways, and things around diversity, things around data, things that we thought we were doing, and maybe we had the information, but that we weren't making as clear as we could do. So having this review to help identify these areas where we can improve. So it was very helpful in terms of helping to improve our user experience, and even being able to identify things like risk and identify that to our users. So in a lot of ways, it helped us make our product better for the end user who's coming onto our application.
Yeah, and I remember in preparing for this conversation, we were thinking about, ultimately it's a business. It's a very fragile or a very difficult environment. You need to have your return on investment. I think we spoke about that. And what I'm hearing is that for those that might be hesitant, including yourself, is that you saw the real benefits at the end of the process. And in fact, it's helped you better the product.
Yeah, I would say that for sure. I mean, that was kind of my key takeaway around, as running a business, and it takes time, it takes energy, and it's developer time to go through this, and definitely hesitation around getting into it as a business owner. And yet there was a lot of quality and return on our investment that we got back out to improve the end product and make it better for that user and stickier.
Excellent. Thanks. Dr. Pottie, how was that experience for you? And share your insights.
I'll start by just giving a brief overview of Strongest Families. It is a child and family mental health focused distance application. And we are a charity, a Canadian charity. And for us as a charity, I'm going to echo what Geoff was saying. We couldn't afford not to do it because as a charity owning, operating our own technology, it's really critically important for us to have that credibility behind us. We've run clinical trials. We're grounded in 25 years of social science research, but it wasn't enough when it comes to our app. We really wanted to make sure we had that stamp of approval. So we knew it was going to be an added value for us to go through the process. Now, as a nonprofit, we're working on very slim resources, and that was one of our hesitations. And I don't even know if it was a hesitation as much as we really had to scramble to kind of figure out how are we going to tackle this. We had this great opportunity to be involved with this comprehensive assessment. And so, one of our takeaways and one of my recommendations, and it comes from my team did all the work. I really can't take a whole lot of credit for that. But the team said it would be really beneficial for whoever approaches this amazing comprehensive assessment is to have one person dedicated. It's really hard to come in halfway through type of thing is what I'm hearing from my IRIS team. For us, going through that assessment, it's not just the quality improvement in the moment to get that score of certification, but it's also that roadmap of quality improvement that my team tells me that they're using all the time now, the 7 kind of pillars under that. For our end users, now we've been co-designing since the beginning of time, the year 2000, not just our program and our system, but our technology as well. And just like Geoff says, we kind of thought that we had this right by design. That's why we do what we do. But this assessment framework identified those little gaps for us so that we could improve the user's experience. We pride ourselves on making sure that, ever since the year 2000, we include diverse voices so that we made sure we were inclusive, but there were still gaps in inclusivity. One of the examples that I can share would be the accessibility piece. And we have skill demonstration videos, tons of them across all of our programs. But the recommendation came, you should have closed captioning. I was like, yes, of course we should have closed captioning. So we then needed to go find the funding in order to do that. So the process for us was probably a lot longer, perhaps. Maybe I'm wrong, but we had to go get the funding in order to be able to make all those improvements. I think the last thing that I'm going to say is what I hear from my team is they learned so much about it as developers, and they said they use the 7 pillars as their roadmap to make sure that what we're developing is safe, to make sure that inclusivity is always that anchor that they look at when they're developing. So it's been extremely beneficial. I highly recommend it, and I think it's a great return on investment to have that stamp of approval.
Thanks. It's great to hear from both of your perspectives. And I'd like to go back to you, Brittany. But before that, I think I was hearing too that you were speaking about the opportunity there to increase the level of certainty that providers have when recommending certain apps to use with their patients or clients. And so before I turn it back to you, Brittany, could you share with us, Courtney, the insights about how this framework helps to cut through the digital noise and really get confidently to the right app for the particular situation that they're dealing with?
Yeah, I think the big benefit of the assessment framework, the stamp of approval from, the badge of MHCC badge, is that there's the transparency to know what is safe and what is being continuously monitored. So that, previously there was talked about liability. So that continuous monitoring allows us to kind of make sure that that's accounted for. And I hear from clinicians every day that patients are more like, they're using digital health technologies more and more now. So how can they answer those questions that come to them? And it's that assessment and that badge that helps them answer those questions, especially for specific patient populations, for specific use cases, whether it's addictions or anxiety. They have that ability now to kind of see which apps are for those use cases and for that specific patient population. So I think it's all about the transparency. It's about the continuous monitoring, and it's about the ability to be able to take those 20,000 apps, but know which ones are actually safe for that specific condition area or for that specific patient, and being able to kind of action it, because, they're out there, but how do we action it in real time in the real world? And that's exactly what Newfoundland's doing with their library. We have these badges now. That's the hope with the MHCC badges, to have that transparency and that actionability now that we have that framework.
Thanks. And so if I go back to you, Brittany, you've been in it now for some time, and, we have different jurisdictions, countries that might be interested in this experience. Could you share lessons from your implementation journey so far that you think would be helpful for other jurisdictions that are looking into this? And how did this, the unique context of this project shape your approach in Newfoundland and Labrador?
Yeah, I think that's an excellent question. And my number one, recommendation would be to leverage your existing connections and collaborate a lot, because you really need to build those relationships early when you're reaching out to apps, when you're, even before that, when you're deciding on which apps to go through the framework. Because as mentioned here, it is a very rigorous process. It does take a lot of time from apps and companies that are sometimes really overburdened and small and don't have a lot of time to really dedicate to this. So when deciding as a province or whatever you may be, which apps you would like to go through the framework, for us, we had kind of a model of, and this isn't everything we do, including lived and living voice. And we're lucky enough to have an amazing organization that works very closely with us to kind of help with those conversations. But they were a part of everything we did. In the very beginning, we reached out to them and asked kind of, in your organization, what apps are people actually using with lived and living voice? What apps are you recommending to people? And along with that, we also have a mental health manager team across the province, which I know is kind of unique to us too, and just having those dedicated resources to mental health. And we met and kind of went together and said, okay, what kind of apps are we seeing that come up a lot? What are we recommending? We also have an existing website, Bridge the Gap, which is our kind of suite for mental health resources and services in Newfoundland and Labrador. And we did have some apps kind of recommended there, and that was through a process of engaging lived voice and our partners. And we kind of did the same thing to, decide upon apps. So even that piece is so important, to kind of make sure that you are utilizing the people around you, collaborating to make sure that you're finding apps that are relevant to your community and population. And I think too, after deciding on those apps, you have to start reaching out quite early, because it does take some time to get through the whole process and all of the assessment. Like there's that initial meeting and then follow-up meetings and just getting people to the place they need to be with the score. So yeah, reaching out early, making sure that you have kind of those connections in place, and always have lived and living voice, and make sure that you're reaching the people that you need to, and testing apps that have been used and will be used.
It's a great point, and I hear too the need to be patient, because the app space is so dynamic. The tech industry is so rapidly evolving, and so sometimes you might have a certain plan, but you need to be flexible in that process. But I also know, Nikki Legg in the room as well. I imagine like senior leadership buy-in and championing is also key to these projects.
Yeah, definitely, and I see you laughing over there, but no, we wouldn't be where we are without Nikki. She's an amazing champion, and she's been in this space much longer than me and has kind of brought it to where it is. But no, she's championed it. We're always looking for the latest and greatest and new things in mental health. And when this opportunity came up with our connection with the Mental Health Commission as well, we couldn't say no. Like we've said, there's so many apps out there. We're trying to find the best ones to recommend, and this is the perfect way to kind of pick out the ones that are, put them in one place. The library itself, we're the first province, I guess, in Canada to launch so far, which is also really exciting. There are other provinces working on it, but no, I think that just having that one space, we do have our website and that will link directly to the app library, but having everything in one space where you could say, okay, if you're looking for mental health and addictions apps, this is the place to go. They've been vetted, they've been through it, they've have all of these criteria, and you could look a little bit deeper. It links out to like all of the, however many criteria, is it 700? I know it's a lot of criteria. 400, there you go. So yeah, you could look through all of those and see what you're getting yourself into as an app, or what you could be looking into if you're looking to have a library of your own.
Yeah, and I think now that we're in it and we have experience, we now have a bit of a community, which is also helpful, over time with yourself and maybe other jurisdictions that consider it, but even amongst the app developers. I'm conscious of time. I'd love to bring it back to the room. So maybe final questions for Geoff and Dr. Pottie. Now that you've been through it, where do you see this going? Has it helped you in terms of your credibility, thinking about future opportunities with funders, kind of like that pitch, towards the future?
Oh, yes. As soon as we got those badges, every presentation that I do for government and other funders, it's right there. It just adds that credibility. With Strongest Families, we have like 21 iterations of our different programs and levels of intensity. And we didn't want to be one of the organizations that you have an app for this, an app for that, an app for this. So we made a conscious effort to make sure that our system was purpose-built so that families could have just one app that was fully integrated that they could easily navigate. And I think having that stamp of approval and having, and I really sincerely hope that other provinces and territories will adopt this library as well. It'll make the standardization of apps for families to navigate and children to navigate so much easier, and hopefully it'll improve, kind of their outcomes and the fact that they're accessing very effective and inclusive apps.
Excellent. And maybe to Geoff, and I mean, just a little plug for the Mental Health Commission of Canada, maybe other countries would also want to just borrow the framework and the app process with ORCHA and kind of implement it since it's already been made. Geoff?
We also work with workplaces, so that's who we're approaching a lot of the time, as well as population health, working with a couple of Atlantic provinces. And so having that, going through that process and having that, it informs our privacy impact assessment. And so that process is a big process that when we're working with different organizations. And so now that's part of it. I mean, our brochure, it's right there on, the first page where we put it there. And so it's front and center about what we've gone through. And we hope that it continues to grow and it's more recognized, in industry. I'm not sure, we have to educate a little bit at this point, and that makes sense. But I think more and more it will get recognized. And I think something that we talked about was just about, it could be a cumbersome process going through like a privacy impact assessment with an organization, and hopefully this can get recognized as part of that and help check some of those boxes more readily.
A great point. It could help you ultimately meet other standards as well and demonstrate that you meet that really high standard, so avoid kind of having to redo it for other types of regulations. So I guess now I'd love to turn it back to you in the room to see if there's any questions or comments that you'd like to pose to any of these panelists. Yeah, in the back. I'll bring the mic over to you. It'll give me some movement, or, well, up to you. I'm a diplomat. I'll meet you where you're at.
Okay, well, thank you so much. I find this area so interesting and overwhelming. My name's Chris Bartha. I'm the Senior Executive Director for Student Mental Health at the University of Toronto. We have over 100,000 post-secondary students at the University of Toronto. And we have an ambitious mental health strategy unfolding that has, for the most part, been reasonably successful. This is a space where I think we are all a bit lost because students are very aware of mental health. It's a very topical issue across the post-secondary sector. There are many companies that approach me a lot about wanting to market what they have that targets young people. And out of all the apps that we have, if you ask a student, where do they go for support, for mental health advice or companionship? ChatGPT. That's where they go. And they also go to Reddit for advice. So all these formalized tools that we have, that's not where they're going. I'm not saying they're not going there at all, but I'm just saying if you ask students their opinion on these things, they tend to go in those directions. So we have a huge opportunity. I am not a university person. I joined the university 3 years ago from the academic health science community. Dr. Pottie, we met a long time ago, if you recall. And we have, this is a very large population in this country. They are not the same as adults, and they're not the same as pediatrics. And the Mental Health Commission of Canada has post-secondary student mental health standards, done great work in this space. So A, we have an opportunity, and B, with respect to ORCHA, which I'm honestly don't know enough about. I'm so glad I came to this session, and this collaboration with the province of Newfoundland is fantastic. How can I find out more about your organization? Do I have to pay to be a member? Do you list your approved apps where you've done a review and you would advise that they're high quality? How can I get more involved and understand this better?
Yeah, absolutely. Great question. So ORCHA, which stands for the Organization for Review and Care in Health Apps, they're actually UK based. So they have a global baseline review, which has minimum standards. We worked with eMHIC25, which added the lived experience, cultural sovereignty, and Indigenous populations elements to that framework, which is why you see 400 plus added onto that criteria. And to answer your question, no, you don't have to pay to see which apps have been assessed by ORCHA themselves. That is available in, we call it ORCHA Verify. It's on the website. You're able to search those applications that have been, those tools that have been reviewed. There is an element that goes a little bit deeper, into the evidence part of it and reports from those assessments that we've created. That is a paid functionality, but there is opportunity with eMHIC25 to capture that information and get that information that we'd be happy to, I think, talk to you about.
Great.
And it's on the eMHIC25 website too.
Thank you so much.
Yeah, there's more information on the website. Certainly pop by our booth. We'd love to talk more, and because these are exactly these types of collaborations that we want to explore now that we have a really good use case experience with the government of Newfoundland and Labrador. So we can chat after.
Congrats to Newfoundland, and I'm available for an invitation to come and see what you're doing anytime.
Also a great place to go. So I think we might have time for one final question. And in the meantime, if you don't mind, there's a QR code there that you can go and answer a survey. I know that we all have survey, but we just want to learn how you think this session went and always looking to improve. So if you don't mind, do that for us. I'll bring you the mic.
Thank you so much for sharing your experience. It's so nice kind of seeing under the hood of the process. So my question is still in the vein of education. So now that you have this framework, what do you envision kind of the education and training for organizations, providers, and patients? What will that look like?
Okay. Well, I know that specifically for the Newfoundland and Labrador app library that we've created, we're working on strategies to educate the e-mental health providers, and part of that is the webinar that we're planning to kind of how you navigate the app library, how you know what's safe, what the criteria is for eMHIC25, why those apps were chosen for those specific patient populations, and how it kind of incorporates into what Brittany was saying, which is the Bridge the Gap site, the lived experience that they're working with. So that's kind of the first step of what ORCHA likes to call activation. And that is activating those providers to then have the ability to use those digital health tools in their practice and ensure that that is part of their everyday clinical practice. Because that is the main goal, to get it to the patients and ensure that they have that provider-patient education, but also check-ins and reliability on those products to then check in the future and how they're using it and how they're incorporating it into their daily lives.
That's good. Well, I think it's the first time in my career that I've seen people stay beyond the lunchtime. Like we're just a little bit over, which is fantastic. It says a lot about the discussion panel. So a round of applause for our speakers. And we'll be around, so if you want to learn more, you can visit us at the mentalhealthcommission.ca website. We have a booth, and have a good lunch.